Okay, so I'm just going to talk briefly about the corporate scorecard, which, as you know, is kind of our monthly report card, just so that we know how we're doing. I read an interesting quote recently that says, if you're not keeping score, you're just practicing. And I know that we all work way too hard for this to just be practice, right? This is the real thing. So it's important that we do keep score, and that way we can celebrate our successes better. And this page is showing that we're doing really well. This is the category that we call service excellence. So some of the things that we look at under this category are things like our mortality rate, which of course is really important. We don't want people dying if we can prevent it. Hand hygiene and patient satisfaction. And because the numbers, the current year to date and the current period, they're all in green, so that's a good sign. That means that we have met or even exceeded, done better than our target. So really pleased about that. You'll note that our mortality rate is coming down significantly. That's one of our top priorities as an organization, and we've had a lot of focus on that recently. The doctors and the health record staff have been working really closely and going back over some of the charts of folks that died just to make sure that we have coded them properly, because that factors into how this rate is calculated, and that's one of the reasons why we've been able to get that so low, in addition to lots of other things we're doing around evidence-based care and using order sets and care pathways. So a lot going on there. The next category is fiscal responsibility. And here we look at a couple of things. The budget variance, and Corey has talked about that already, and our volumes. We're looking very good there. So those first two are in the green. One of the indicators that we continue to struggle with, I don't know the last time I saw this one green, it's usually red or yellow, but we keep working on it. This is the category of conservable days. So for those of you who haven't seen this data before, what that means is every time a patient gets admitted to the hospital, we see a lot of the same types of clients all the time. So you can begin to have an idea of approximately how long they're going to be here. And every hospital is the same. You know, all of the hospitals that see congestive heart failure or moms having babies or strokes or whatever, you have an idea of approximately how long the person is going to be in a hospital. So that's your expected length of stay. And what we track is how their actual length of stay compares to what was expected based on the knowledge we have and what our other peer hospitals are seeing. So when we go over and the actual length of stay is more than what was expected, that's called a conservable day, because it means we could have found a way perhaps to save that day. Did we connect with home care soon enough? Were we waiting for lab results to come back? Did the person get an infection that perhaps could have been avoided? So it's about understanding those factors that cause people to stay longer than expected. So we continue to work on ways of getting that down, but right now we're at 17% of our days are days that weren't really expected, and maybe we could have done something about it. We want to be closer to 15%. Okay, and the last indicator is alternate level of care, and that's folks that are waiting in the hospital for, most often for a nursing home. And overall for the year, we're doing well there. Did I skip one? I think I did. Went too fast. Yeah, oh, sorry, you're clicking and I'm clicking, that's why. This one has a lot of indicators. This is our access to care category, because obviously that's why we're here, is to give people timely, quick access to the care that they need. And the first indicator is one that we really struggle with, and that is getting people that need a bed. They come to the emergency department, need to be admitted. We can't always get them into a bed as quickly as we would like. And the numbers that you see there are in hours. So our target for AJAX is to get people that need a bed into a bed in 56 hours, and Centenary it's 43. So we're looking at 2 days or more that people, that's our target. The provincial target is 8 hours, so we're not even in that same ballpark, but we're just trying to get to 56 and 43. And although we've made some improvement, we're not quite there yet. But there are a lot of initiatives in place to help us with that, including the opening of 10 new short stay beds at the AJAX site in January. That is going to help us with that. Our other wait time targets are looking pretty good for the most part. I think there's one there that's in the yellow, but for the most part we're meeting our wait times for MRI and CAT scans and wait time for knee or hip replacements. And the final category is team engagement, and this is what Renee and Ahelia were talking about. Staff satisfaction, physician satisfaction is really important, and it's contagious because it spreads to to patients. So happy staff leads to happy patients. So it's important that we look at this. And the staff satisfaction is in the red, but really this is in transition. We really don't know because we've just introduced this brand new survey that you all got in the mail. It's the first time we've done it. So we really don't have any results yet on that. So that's all going to change. What you see up here is old data from a different kind of survey that we used last year. So that's all going to change. And I think everyone knows about the workplace champions and all of the things that we're doing to try and get staff involved. Sick time is one that we continue to struggle with. Our target is 4.25%, and we're at 4.4 right now. So we're not quite where we want to be. We want that as low as possible. The other indicators there, one of them is a lean indicator, because we want all of the departments to be practicing the lean philosophy that we adopted in 2008. So we track the percentage of departments that have certain things in place when it comes to lean. And our target that we want to get to by the end of March is 100% of departments all meeting the requirements for lean. And as of the end of December, we were at 66%, so it was 2/3. And I'm really confident that by the end of March, we'll hit that 100. And physician satisfaction, unfortunately, we don't have any data yet, but they got a very similar survey to the one that the staff got. So we'll start to get better data on physician satisfaction as well.